Good day, everyone.
I am Mariah Angela F. Pineda.
I am Krizanne Malit.
I am Irish De Leon.
And we are from BS Nursing 1.
So our task for today is to assess the patient's peripheral vascular system.
The purpose of this procedure is to identify any signs or symptoms of PVD, including arterial insufficiency, venous insufficiency, or lymphatic involvement.
This is accomplished by performing an assessment first of the arms, then the legs, concentrating on skin color and temperature, major pulse sites, and major groups of lymph nodes.
So the equipment needed are centimeter tape, stethoscope, Doppler ultrasound device, conductivity gel, tourniquet, gauze or tissue, waterproof pad, blood pressure cuff.
Identify the client, then prior to perform the procedure, introduce ourselves to the client and what we are going to do, why is it necessary, and how we could the client cooperate.
Okay, ma'am, I am your nurse for the day. So, ma'am, may I know your name?
My name is Krizanne Malit.
And when is your birthday?
December 5, 2002.
How old are you now?
I am 19 years old.
Okay, so I will be assessing your peripheral vascular system, and there are times that I will be palpating, touching, or holding your body parts. Is that okay with you?
Yes, nurse.
Okay, ma'am, you just have to follow my instruction so that we can cooperate with each other, okay? So before we start, ma'am, I will just have to ask you a few questions regarding your health status. So is that okay for you, ma'am?
Yes.
Okay, for the current symptoms, have you noticed any skin changes?
No.
So the rationale behind this is that cold pale, clammy skin on the extremities and thin, shiny skin with loss of hair, especially over the lower legs, are associated with arterial insufficiency. So ma'am, do you have any leg pain, heaviness, or aching?
No.
So the rationale behind this is that peripheral arterial disease or PAD can develop over a lifetime, and often symptoms do not appear until there is a 60% blockage. Although peripheral venous disease is not common as PAD, it often occurs with PAD but can occur in isolation. So for the next question, ma'am, do you have any leg veins?
No.
So the rationale behind this is that varicose veins are heredity but may also develop for increased venous pressure and venous pulling. So in standing in one place for a long period of time may also increase the risk for varicosities. So for the next question, ma'am, do you have any leg sores or open wounds?
No.
So the rationale behind this is that PVD is often associated with delayed wound healing. So ulcer is associated with arterial disease, are usually painful and are often located on the toes, foot, lateral ankle. And for the next question, ma'am, do you have any swelling in your legs or feet?
No.
So the rationale behind this is that peripheral edema results from an obstruction of the lymphatic flow or from venous insufficiency. For such condition, on incompetent valves or decreased osmotic pressure in capillaries.
So the next, ma'am, is do you have any swollen glands or nodules?
None.
The rationale of this is enlarged lymph nodes may indicate a local or systematic infection. So let's go to your past history. Do you have a previous problem in circulation of your arms or legs?
None.
The rationale of this is a history of prior PVD increases a person's risk for a recurrence. Symptoms such as an absence of prior palpable pulse, cool, and legs. The next is, do you have a heart or blood vessel surgeries or treatments?
None.
The rationale of this is previous surgeries may alter the appearance of the skin and underlying tissues surrounding the blood vessels. Grafts for bypass surgeries are often taken from veins in the legs. The next is we will go to your family history. Do you have a varicose veins, diabetes, hypertension, coronary heart disease, or elevated cholesterol or triglyceride levels?
No, yes.
The rationale of this is disorders or abnormalities tend to be hereditary and cause damage to blood vessels. An essential aspect of treating PVD is to identify and modify the risk factors. So let's proceed to your lifestyle and health practices. Do you take cigarettes or other forms of tobacco on your past or present use?
No.
The rationale of this is smoking significantly increases the risk for chronic arterial insufficiency. Smokers with PAD had a lower self-reported quality of life and short claudication pain onset when smoking than non-smokers with PAD. The risk increases according to the length of time a person smoked and the amount of tobacco smoked.
So ma'am, do you do any regular exercises?
Yes, at least 3 times a week.
So the rationale for this is that exercises or regular exercises improves peripheral vascular circulation and decreases stress, pulse rate, and blood pressure, decreasing the risk for developing PVD. Ma'am, do you use any oral contraceptives?
No, nurse.
Rationale for this is that oral or transdermal contraceptives increase the risk for thrombophlebitis, Raynaud's disease, hypertension, and edema. Are you experiencing any stress in your life right now?
No.
Rationale for this is that stress increases the heart rate and blood pressure and can contribute to vascular diseases. Do you have any peripheral vascular problems that may interfere your ADLs?
No, nurse.
So the rationale for this is that if clients perceive the appearance of their legs as disturbing, their body image or feelings of self-worth may be negatively influenced. Do you use any medications to improve circulation or control blood pressure?
No, nurse.
Rationale for this is that drugs that inhibit platelet aggregation may be prescribed to increase blood flow. So do you wear a support hose to treat varicose veins?
No, nurse.
Rationale for this is that support stockings help to reduce venous pooling and increase blood return to the heart. Then we can now perform hand hygiene and observe appropriate infection prevention control. Then we have to ask the client to put on a gown. So ma'am, can you please put on this gown?
Okay.
Thank you. Okay, so after the client has put on her gown, we can now provide client privacy. So assuming that there are curtains and doors, we have to close the curtains and doors. Then we can now proceed to the physical assessment of the peripheral vascular system. So the first thing we will do is to inspect arms bilaterally for size, presence of edema, and venous patterning. Okay, ano po natin, ma'am? Let me do this. Okay. So arms are bilaterally symmetric with minimal variation in size and shape. No edema or prominent venous patterning, meaning they are normal. When it is abnormal, it may be because of lymphedema, which is from blocked lymphatic circulation, which may be caused by breast surgery. Then we have to inspect bilaterally for skin color. Okay. Alright. So color varies depending on the client's skin tone. For my client, she is light color bilaterally on both hands and arms, meaning normal. When abnormal, Raynaud's disorder is a vascular disorder caused by vasoconstriction or vasospasm of the fingers or toes, characterized by rapid changes of color such as pallor, cyanosis, and redness. Then, we have to inspect fingertips for clubbing. Okay, so there's no presence of clubbing on the patient's fingers. Then next, we have to palpate fingers, hands, and arms for temperature using the dorsal surface of our fingers. So my patient's skin is warm bilaterally from fingertips to upper arms, means that they are normal. So a cool extremity may be a sign of arterial insufficiency, and cold fingers and hands, for example, are common findings with Raynaud's, which is an abnormal finding. Then we have to determine capillary refill time. It is normal because in just a second, the capillary beds return to its original color. If it exceeds 2 seconds, it may indicate vasoconstriction, shock, or hypothermia, which are abnormal. Then palpate radial, ulnar, and brachial pulses. So first for radial. We got a normal finding having the radial pulses bilaterally strong or 2+, and have artery walls and have resilient quality. Next for ulnar pulses. Normally, the ulnar pulses may not be detectable. Next for brachial pulses. Okay. So brachial pulses have equal strength bilaterally. Then we have to palpate epitocrial lymph nodes behind the elbow in the groove between the biceps and triceps muscles. Okay, ma'am? Okay. Normally, epitocrial lymph nodes are not palpable.
So ma'am, let's now proceed to the performance Allen's test by occluding the radial and ulnar arteries and observing for palm and pallor. Then I will going to release the ulnar artery and watch for color to return to hand. So ma'am, may I have your right hands? So ma'am, I want you to close your fist. And then open, ma'am. Another one, ma'am. Okay, now your left hand, ma'am. Following the same procedure, ma'am, I want you to close your fist. And then open. And then close, ma'am. Okay, so for the normal findings, pink coloration returns to palms within 3 to 5 seconds if the ulnar artery is patent. Next is pink coloration returns within 3 to 5 seconds if the radial artery is patent. Next is for the abnormal findings with arterial insufficiency or occlusion of the ulnar artery, pallor persists. So ma'am, let's now proceed to the assessing of your legs. So ma'am, if it is okay for you, if I will transfer you to a hospital bed.
Yes.
Okay ma'am, follow me. So ma'am, I'm going to inspect bilaterally for skin color. So ma'am, can you please lay down? So for the normal findings, pink color for lighter skin, clients, and pink or red tones visible under dark pigmented skin. So there is no changes in pigmentation. So for the abnormal findings, pallor especially when elevated and rubor when dependent suggests arterial insufficiency. So ma'am, let's now proceed to the inspect bilaterally for distribution of hair. So for the normal findings, the hair covers the skin on the legs and appears on the dorsal surface of the toes. So for the abnormal, loss of hair on the legs suggests arterial insufficiency. So let's now proceed to the inspect for lesion or ulcers. So ma'am, I'm going to inspect again. Okay, for the normal findings, legs are free of lesions or ulcerations. So ma'am, let's now proceed to the inspection of your edema, unilateral or bilateral. So ma'am, can you please bend slightly your legs? Okay ma'am, how about the other one? Okay, so for the normal findings, identical size and shape bilaterally, no swelling or atrophy. So next, if a client has edema, determine whether it is pitting or non-pitting. If a client has pitting edema, rate on 1 to 4 scale. So for the normal findings, no edema. So ma'am, can I remove your socks first?
Yes.
So let's now proceed with the palpation of skin temperature. So for the normal findings, toes fit and equally warm bilaterally.
The next is I will palpate the superficial inguinal lymph nodes while keeping the genitals straight. If detected, note the size, mobility, or tenderness. Since we cannot perform the actual assessment, I will just state the procedures. First, I will expose the client's inguinal area, keeping the genitals straight. Fill over the upper medial thigh for the vertical and horizontal groups of superficial inguinal lymph nodes. Next is determine size, mobility, or tenderness. Repeat the palpation on the opposite thigh. The normal findings of this is non-tender movable lymph nodes up to 1 or even 2 centimeters are commonly palpated. Next, I will palpate the auscultate femoral pulses over arteries. First is listen for bruits. The next is I will palpate the femoral pulses. First is ask the client to bend the knee and move it out to the side. Next, press deeply and slowly below and medial to inguinal ligament. Use 2 hands if necessary. Release pressure until you feel the pulse and repeat the palpation on the opposite leg. Compare amplitude bilaterally. The next is the normal findings. The normal findings of this is femoral pulses strong and equally bilaterally. The next is osculate the femoral pulses. If arterial occlusion is suspected in the femoral pulse, position the stethoscope over the femoral artery. Listen for bruits and repeat for other artery. The normal findings of this is no sounds auscultated over the femoral artery. The next is I will palpate the popliteal, dorsalis pedis, and posterior tibial pulses. First, I will palpate the popliteal pulses. I will ask the client to raise her knee. Ma'am, can you raise your knee? Okay, ma'am, can you roll over? The normal findings of this is it is not unusual for the popliteal pulse to be difficult or impossible to detect and yet for circulation to be normal. The next is I will palpate the dorsalis pedis pulses. Dorsiflex the client's foot and apply light pressure to lateral to and along the side of the extensor tendon of the big toe. The pulses of both feet may be assessed at the same time to aid in making comparison. Now I will assess amplitude bilaterally. Okay, the normal findings of this is dorsalis pedis pulses are bilaterally strong. This pulse is congenitally absent in 5% to 10% of the population. Next, I will palpate the posterior posterior tibial pulses. Palpate behind and just below the medial malleus. Palpating both posterior tibial pulses at the same time aids in making comparison. Assess amplitude bilaterally. Okay, the normal findings of this is the posterior tibial pulses should be strong bilaterally. However, in about 15% of healthy clients, the posterior tibial pulses are absent. The next is I will inspect for varicosities and thrombophlebitis by asking the client to stand. Okay, ma'am, can you please stand? We are doing this because varicose veins may not be visible when the client is supine and not as pronounced when the client is sitting. So next, I will inspect your superficial vein thrombophlebitis. To fully assess of this, I will suspect phlebitis slightly to palpate tenderness. Okay, ma'am, you may now lay down again. When thrombophlebitis is present, note redness or discoloration on the skin surface over the vein. The normal findings of this is veins are flat and barely seen under the surface of the skin. The next is assess for arterial or venous insufficiency by eliciting bilaterally for human signs by having clients on supine position. Next is flexing knee 5 degrees and quickly squeezing the muscle against the tibia. So the pulses in the legs are weak. Further assess for arterial insufficiency is warranted. The client should be in supine position. Place one forearm under both of the client and ankles on the forearm. Raise the legs about above 12 inches of the level of the heart so you can support the client's leg. The normal findings of this is feet pink to slightly pale in color in light skin client with elevation. Inspect the soles in dark skin client, although it is more difficult to see subtle color changes in darker skin. So next is ask the client to sit up and dangle legs off the side of the examination table. Note the color of the both feet and the time it takes for color to return. Okay, ma'am, can you please sit? Can you dangle your legs, ma'am? Okay. So the normal findings of this is normal responses with absent pulses suggest that an adequate collateral circulation has developed around an arterial occlusion. The overall condition of the patient's peripheral vascular system is normal with only little to no abnormalities.
The possible nursing diagnosis includes ineffective health maintenance related to behaviors reflecting lack of understanding behaviors that promote wellness and prevent recurring vascular problems, imbalanced nutrition for less than body requirement related to inappropriate food choices, and disturbed body image related to edema, leg ulcerations, or varicosities.
So the possible collaborative problems may include a risk for complications on hypertension, risk for complication on peripheral vascular insufficiency, and we may refer this client to a primary healthcare provider to further evaluate and assess for potential complications. Also, needs a dietary plan for body requirements related to inappropriate food choices.
And that will be all. Thank you.